We believe that as a residency program, we have a tremendous opportunity to be an asset for our communities.
If you look at some of the things that we've been able to accomplish over the past 4 decades, we're a pretty cutting-edge institution.
This is a teaching program, so the faculty are very involved in teaching you every step of the way.
I've had a lot of exposure to a number of different places, and I find this second to none in the quality of the faculty and the quality of the residents.
You're not here to become a good doc. You're here to become a great doc.
We have the opportunity to recruit residents and students from all over the world, and it's a very diverse program, which is kind of exciting.
And those are things that I actually looked for in programs. I looked to see which programs focused on education, focused on procedure training, focused on inpatient with outpatient experience to help me grow.
We think most of residency needs to be a hands-on approach, and you're going to get that here in Quincy from day one.
And I like that we're the only residents here as well, so we get a lot of one-on-one attention.
And that, I think, provides the very best patient care. It also provides the residents the opportunity to model that as they go forward in their career. And in our opinion, that's the very best way to practice medicine.
We're also fortunate to be blessed by really advantageous geography for a family medicine residency program. And by that I mean Quincy and Blessing Hospital is the biggest town and the biggest hospital within a 2-hour radius.
All of that made me want to come here, and the fact that this was a little bit of a smaller town, the cost of living is less here, of course.
The culture here is one of family. That is something that we purposefully talk about, that we purposefully try to develop.
This program feels very homey, and so you're welcome from the second that you come here.
The culture here is very much centered around a team approach to medicine, and I think that's a great strength.
My fellow residents and I are very respectful of each other, and we're a group of really hardworking people.
The School of Medicine and the residency programs need to be deeply involved in their communities. Here in Quincy, we do that with our addiction medicine services. We do that with our outreach to mental health and disadvantaged children. We do that here most recently with our response helping the community to the COVID epidemic.
There's definitely a need for more family physicians. As we go forward in the coming years, there's going to be more of a shortage of family physicians.
And be able to treat not only people, but families and communities.
We are the only residents, so when we do work with our community attendings, they know who we are. We have an established base here in Quincy.
But we know the patient, and we know them better than anyone else. They have very deep relationships with us.
When you look at what a family medicine residency can do, it's like we're creating superheroes. You know, we believe that a great family doc is going to be able to take care of 95 to 99% of everything that walks through their door.
And I think that's why most family docs choose family medicine, is because of that longitudinal relationship situation that you have with your patients.
And I think the residency did a great job of matching personalities as well as the Thrive for Medicine.
We celebrate where our residents go. We have a map in our hallway with a stick pin for where all of our graduates have been for the last 40+ years.
I love to look at the map and see where everyone has gone. It amazes me that we have people that grow up in New Jersey and end up in Montana. You know, it's a very diverse group.
Our graduates come out 4 or 5 steps ahead than some other graduates that maybe weren't as patient-centered in their residency training programs. Our graduates report that they were ready to hit the ground running from day one.
One in particular was a young doctor that I trained with here, and she ended up in Togo, Africa. And her and her husband basically ran a hospital there. She had done extensive training in obstetrics, and so they pretty much did everything. They ran an emergency room and an inpatient hospital, as well as doing the obstetrics there. And so she's a pretty amazing physician, and I'm pretty proud to call her my friend.
The deep end's really only scary at this part in your training when you're alone. And you're never alone with us.